Hello friends, I'm Dr. Gulhima Arora from Mehekta Gul Derma Clinic, New Delhi. I'm a consultant dermatologist and in practice since over 18 years. Today we're going to talk about how, when and why about sunscreens, and everything that you ever needed to know about sunscreens is going to be discussed. Now, sunscreens are the single most important product in your skincare regime. And it has to be worn 365 days in a year, whether you're indoors or outdoors, or whether it's raining or it's broad sunlight. 80% of the ultraviolet rays exposure occurs by the age of 18, and one must start wearing a sunscreen in childhood. Yes, you heard it right. You must begin wearing a sunscreen in childhood till your last day and each and every day. Now let me tell you a little bit about the history of sunscreens. And you know, sunscreens have been used since times immemorial, and even the Egyptians used ingredients like rice bran and jasmine to protect their skins from the sunlight. Quinine, which is an anti-malarial drug, was also used to prevent patients from getting exposed to ultraviolet rays. Now, before we dive into everything, the A to Z of sunscreens, let us talk a little about the ultraviolet rays, the actual villain that we are all so scared about. So what are these ultraviolet rays? The electromagnetic spectrum is composed of the ultraviolet rays, the visible light, and the infrared light, among the other rays. And it is these three spectrums that we are worried about: the ultraviolet rays, the visible light, and the infrared light. Now, coming to the ultraviolet rays. Ultraviolet rays is composed of UVC rays, UVB rays, and UVA rays, the UVA rays being closer to the visible spectrum. Now, what we are worried about are the UVA rays and the UVB rays, because the ultraviolet C rays are actually filtered by the ozone layer of the atmosphere. But with the depletion of the ozone layer, we're going to be very, very concerned about this spectrum of the ultraviolet rays as well. So it is the UVB rays and the UVA rays that we are concerned about in the ultraviolet ray spectrum. Now, 95 to 98% of the rays that reach the surface of the earth are the ultraviolet A rays or the UVA rays. And just 2 to 5% are the UVB rays. Now, why are we concerned about these rays? Because the UVB rays are the ones we are worried about, because they are the carcinogenic rays, or the rays that can give rise to skin cancer. They also are the cause of sunburn. The ultraviolet A rays have a longer wavelength, and they penetrate deeper into the skin and give rise to free oxygen radicals or reactive oxygen species, which are concerned with pigmentation of the skin and photoaging. Now, if we talk of the wavelengths, ultraviolet C has a wavelength between 100 and 280. Ultraviolet B has a wavelength of 280 to 320 nanometers. And the UVA rays have a wavelength of 320 to 400 nanometers. From 400 to 700 nanometers are the visible rays, and beyond 700 are the infrared rays. Now, coming to the next part of the electromagnetic spectrum, which we are very concerned about now, and that is the visible light. Now, as I told you, the visible light has a wavelength between 400 and 700 or 750 nanometers. And the visible light is actually bothersome because a lot of our electronic devices, LED screens, emit these rays. And the high energy visible light, or the blue spectrum, you know, the visible light has a spectrum between VIBGYOR, the violet in the beginning and red at the end, which is the longest wavelength. Now, we are concerned about the blue spectrum around 570 nanometers, because these rays cause pigmentation and pigment ducting that can last up to weeks. And 50% of the free radical damage or the damage to the DNA or the genetics of the skin occur because of visible light and the infrared light along with the UVA rays. So 50% of the free radicals are formed by the ultraviolet A, and the other 50% by the visible light and the infrared light. Now we are concerned about damage to the DNA or the core of our cells with the longer wavelengths which penetrate deeper, that is the UVA, the visible and the IR rays. The ultraviolet B rays, on the other hand, do not penetrate that deep, but they can give rise to, as I had said, cancers and sunburn. Now, why IR rays or the infrared rays? Now, these come up, they are like the microwaves or the heat in the kitchen that is there. And these also cause release of free radicals. They neutralize the antioxidants of the body, which are your natural defense. They cause DNA damage, and they can also cause persistent pigment darkening. So for skins that pigment easily or have a pigmentary disorder or some kind of hyperpigmentation, these rays are very, very harmful. With that overview of the electromagnetic spectrum, let's move on to the main topic of discussion, sunscreens. So why do we even need to wear a sunscreen in the first place? Well, sunscreens are needed to prevent skin cancer, which is the single most worrisome thing that is on our minds as far as not wearing a sunscreen goes. And according to the American Academy of Dermatology, 1 in every 5 individuals in the United States is going to suffer from a skin cancer in their lifetime. 1 in every 5. Isn't that a huge figure? And half of these cancers are preventable by just wearing a sunscreen. So would you really want to omit that sunscreen? Would you really want to omit something as simple as applying a sunscreen every day? Well, we may not be that worried about skin cancers because it's more common in skin types 1 and 2, which burn easily and tan less. With a lot of pigment in the skin, like type 4 and 5 skins, which tan easily and burn less, we have a protective pigment in our skins called melanin, which is 5 times more protective of the ultraviolet rays than skins which do not have melanin. But even then, it is not necessary that people who have type 4 and 5 skins cannot develop skin cancer. And as I said, since it is the most preventable type of cancer, I think it is worth wearing a sunscreen every day. The second reason why you need a sunscreen is to prevent that premature photoaging. We all know that the ultraviolet rays, as I said, penetrate deep. They cause destruction of the DNA, and the deeper rays like UVA also break down the collagen and elastin of your skin, the proteins that give your skin the turgor, the elasticity, the firmness, and the glow. When these are broken down because they stimulate the enzyme matrix metalloproteinases, which break down the collagen, what happens is your skin becomes saggy, it becomes wrinkled, and you look older than you actually are. So sunscreen is the most important anti-aging product in your skincare regime. The other reason why it's so important to wear a sunscreen is to prevent certain photoaggravated dermatosis or certain skin conditions that get aggravated by the ultraviolet rays or the sun rays. And among them would be conditions like xeroderma pigmentosum or solar urticaria or polymorphous light eruption, etc. So these are skin conditions that worsen with the exposure to sunlight or ultraviolet rays, and hence it's important to wear a sunscreen even for these people. Organ transplant patients are also advised to wear a sunscreen every day because you want to prevent certain skin conditions like actinic keratosis in them, which are precursors or pre-lesions of skin cancer. So don't want them to get invasive skin cancers, and hence all organ transplant patients, especially the renal transplant patients, are advised to wear a sunscreen. People with certain autoimmune conditions like systemic lupus erythematosus or SLE are also, it's also recommended for them to wear a sunscreen, because it is said, there are studies that say that wearing a sunscreen can prevent further worsening or a systemic involvement involving the renal system as well. Sunscreen can even act as a minimal makeup, especially with the tinted ones that are coming now with the mineral filters. They do give a little base on your skin and can even act as a makeup. Now, after learning as to why we need to wear a sunscreen and why we need to wear it each and every day, whether you're outdoors or indoors, let's get to know a little more about sunscreens, a little general knowledge about sunscreens. So, a lot of us feel that higher the SPF of a sunscreen, because that's a term that goes synonymous with a sunscreen, we feel that higher the SPF, the better the protection, and the less number of times you'll need to apply a sunscreen, or the better the sunscreen is. But it is definitely not so. So when you talk of a broad spectrum sunscreen, so let's talk about a broad spectrum sunscreen, because that is what all dermatologists recommend for use. A broad spectrum sunscreen can have an SPF as low as 30. And that is because an SPF of 15 is only going to protect you from 93% of the ultraviolet rays. An SPF of 30 is going to protect you from 96.7%, an SPF of 45 by 97.8%, and an SPF of 50 by 98%. So beyond an SPF of 50, the 60s and the 70s, which are not actually allowed to be used on labels, is not going to give you too much of an added advantage. So while we are talking of SPF, what is SPF? SPF stands for Sunburn Protective Factor, and it is the time period that your sunscreen is going to let you stay from getting burnt than without applying the sunscreen. So for example, if you get a sunburn within 10 minutes of exposure to the ultraviolet B rays, an SPF of 30, which is a broad spectrum sunscreen, would allow you to stay 30 times more, or for 300 minutes in the sun without getting sunburnt. So SPF is Sunburn Protective Factor, and it is the measure of how much UVB rays is going to be filtered from your body. Now, coming back to the broad spectrum thing, I told you an SPF of minimum 30 is required for a sunscreen to be labeled as a broad spectrum one. The second thing you have to look on the label to make sure your sunscreen is broad spectrum is that it covers the UVA rays, the UVB rays, the visible light, and the infrared light. So it should give you a full coverage. The next thing you need to look is that its critical wavelength is above 370 nanometers. We'll discuss all of this subsequently. The next thing you need to see on the label for a broad spectrum sunscreen is that the PPD, or the measure of the UVA rays, or the UVA rays that get filtered, it should be greater than 4. And PPD stands for persistent pigment darkening. So another thing that you have to look on the label is whether the sunscreen is water resistant or not, or very water resistant or not. Now, we're going to discuss about all these terms subsequently. So recapitulating about what you need to look for in a broad spectrum sunscreen is 1, whether it has an SPF of 30 and above. 2, its critical wavelength is greater than 370 nanometers. 3, it covers the entire electromagnetic spectrum from the ultraviolet rays to the infrared rays. 4, it has a PPD of greater than 4. And 5, that it is water resistant. Now let's discuss about these label characteristics one by one. SPF is something I've told you in detail already. Now coming to the measure of the protection from the UVA rays, I told you SPF is a measure of the ultraviolet B, or the UVB rays. But you need to protect the UVA rays because 95 to 98% of the rays are the UVA rays. Now, PPD is persistent pigment darkening, which is 1/3 the SPF, and I told you a broad spectrum sunscreen has to have a PA factor of greater than 4. Now, in different parts of the world, there are different measures of the UVA filters or the UVA blockage. So you have the copula as a measure of UVA blockage in Japan. You have the BOOTSTAR rating in the UK. So you must have seen many sunscreen labels with a BOOTSTAR 3+ or 4+ or 5+. That's all a measure of how much the UVA can be blocked. Now, what is critical wavelength? I told you a broad spectrum sunscreen has to have a critical wavelength of greater than 370, and the critical wavelength is the wavelength below which 90% of the ultraviolet rays are filtered. So it should be greater than 370 nanometers. Now, coming to the water resistance. Yes, a sunscreen, broad spectrum sunscreen should be water resistant or very water resistant. What does this mean? This means that a sunscreen is going to maintain its SPF factor with 2 immersions of 20 minutes each in water, being water resistant, and 4 immersions of 20 minutes each in water if it is a very water resistant one. So a water resistant one remains its SPF for 40 minutes and a very water resistant one maintains the SPF for 80 minutes. We finished as to why we need to wear a sunscreen. Now let's come to when do we have to wear a sunscreen. As I've been saying it repeatedly over and over in the video, it has to be worn each and every day, 365 days, 24/7, whether you're indoors or outdoors, whether it's raining or it's pouring or there's bright sunlight or it's cloudy, whether you're on a beach or on the hills, wherever you may be, you need to wear it each and every day till the time it gets dark. Because even if you're indoors, your window panes are only going to filter the ultraviolet B rays or the UVB rays, and the UVA rays do penetrate the windows and cause damage to the skin. Plus, when you're indoors and you're sitting a lot in front of your electronic devices, whether you're working from home or you're Netflixing or whatever you may be doing, or gaming or watching the video on YouTube, it's going to emit the high energy visible rays. So even if you're indoors, you need to apply a sunscreen. When you go swimming, it is a must that you wear your sunscreen. And when you're sweating, it is also a must that you wear a sunscreen and reapply it in both these conditions. When do you wear a sunscreen? You wear it 20 minutes before you step out. Now, how much of the sunscreen are you supposed to apply? Well, the entire body needs about an ounce or a shot glass full of sunscreen. If you're talking only of the face and neck, you need about 1.25 ml, which is 1/4 teaspoon. And if you talk of applying sunscreen in teaspoons over the entire body, well, you need 1 teaspoon for the face, neck, and the head. You need 1 teaspoon each for either arm, 1 teaspoon for the front of the torso, 1 teaspoon for the back, and 2 teaspoons each for the entire leg, including the genitalia. So this equals to a total of 9 teaspoons for a whole body, which is 45 ml. Another measure is applying 2 milligrams per centimeter squared of the sunscreen on the exposed parts. Now, I'm sure none of us apply the adequate dosage, and here applying an SPF of a sunscreen of a little higher SPF does come in use, because if you're underdosing yourself with the sunscreen, and a higher SPF does score a little bit over a lower SPF. How many times are you supposed to apply a sunscreen? Well, you're supposed to reapply your sunscreen every 2 hours according to the American Academy of Dermatology. And this reapplication has to be more frequent if your sunscreen is not substantive or it does not maintain its SPF during sweating or swimming or certain water sports, because if it's not water resistant or very water resistant, it's going to get washed away. And so the application or the reapplication has to be more frequent in such cases. So how do you store your sunscreens? Do you know sunscreens have these filters, the chemical filters, which I'm going to talk about a little later in this video, which get degraded by extreme temperatures. So be careful when you're carrying your sunscreen along with you wherever you're going. Make sure you don't leave it in the glove compartment of your car, because that could potentially degrade the filters in the sunscreen and render it ineffective. So it has to be stored in a cool temperature and in the dark for it to remain and maintain its substantivity or maintain its SPF value. So for how long can you apply your open tube of sunscreen? Well, if you're applying it according to what I told you, according to the correct dosage, your sunscreen is not going to last very long, considering it comes in a 45 to a 60 to a 100 ml tube or bottle. But a sunscreen expires within 3 years of its manufacture. That's taken as an average, unless the expiry date is mentioned on the label. Also, if your sunscreen loses its color, or the phases get separated, it starts oozing out oil separately and the concentrated part comes out separate, so the phases are different, you have to chuck your sunscreen in the bin and open a new one. So what are the formulations of sunscreen? There are so many kinds. You have sunscreen creams, lotions, gels, aqueous-based ones. Which one do you buy? Well, before I come to that, let me tell you there is a term known as GRACE, which stands for generally regarded as effective and safe. Generally regarded as effective and safe, GRACE. And sunscreen formulations are categorized as GRACE or non-GRACE. Now, creams, lotions, gels, sticks, all of these are regarded GRACE, whereas sprays are only regarded GRACE if they have a particle size above a certain size. Okay, so if the particles are above a certain size, only then they are considered GRACE. And powders, sunscreen powders, are not GRACE. Okay, so that's important, because now many people advocate that when you have to reapply your sunscreen over your makeup, you can use a sunscreen powder, but that's not a good idea, because it is not GRACE according to the US Food and Drug Administration, or the US FDA. Now, gel-based sunscreens are the formulation you should look for if you've got an oily skin type or an acne-prone skin type. A cream is what you're going to look for if you have a very dry skin. And if you've got a normal skin or a normal to combination, you can use a lotion-based sunscreen. Now, you also have sunscreen sprays, which are very good when you have to cover the entire body, but there is an inherent risk of inhaling the spray, which can get into the lungs and damage the lungs. And hence, I told you, only if the particle size is below a certain level, then only it is considered GRACE. Now, let's talk about sunscreens in certain specific situations, like in children. Well, according to the US FDA and the American Association of Dermatology, children below the age of 6 months are not supposed to use sunscreens, or rather, you're not supposed to apply sunscreens to them. So that doesn't mean that they cannot go out in the sun, or they're not going to be affected by the harmful rays of the sun, but you have to protect them with clothing, loose, full sleeves, cotton clothing, and make them stay away from the peak times of the ultraviolet rays that fall on the Earth's surface. So I'll come to that a little later. Now, what about children between the age of 6 months to 2 years? Well, you can use a sunscreen in them, but it has to be a mineral-based sunscreen or a physical sunscreen. We'll be talking about this in a while. And above the age of 2 years, you can use chemical or physical sunscreens, or a combination of both, but you have to use it, especially when they're going out to play, or even when they're indoors, or they're swimming, whatever it may be. Now, why shouldn't neonates be applied a sunscreen, or children below the age of 6 months? Well, I told you there are certain filters that chemical filters in sunscreens that filter the UVA rays and the UVB rays. And there's one filter known as benzophenone which blocks the UVA rays. Now that gets conjugated in the liver because it gets absorbed in the bloodstream when you apply it, and it gets detoxified in the liver after it gets conjugated with other water-soluble proteins, and then it's excreted in the urine. So children below the age of 6 months and even elderly patients do not have a very mature liver, and hence they cannot excrete this chemical filter well, and it can potentially cause side effects in them. So you don't use sunscreens in children below the age of 6 months. What about the elderly? Well, they also have immature livers, and it is best to use a physical sunscreen in them which does not have chemical filters, or natural sunscreens in them, and I'll be talking about this in a while. Same goes for pregnant women, because there has been concerns about certain chemical filters being having reproductive toxicities or crossing the placental barrier and affecting the birth weight of children, etc. But studies have not really confirmed this, but because of the scare, it is better that pregnant women also use physical filters or natural sunscreens. Now let's come to a very important part of sunscreens in this video, and that is the types of sunscreens. Sunscreens are of two types, chemical and physical. The chemical sunscreens have chemical filters which block the UVA and the UVB rays, and the physical sunscreens do not have chemicals as filters, but they have inorganic salts which act as filters. The chemical sunscreens get absorbed a little bit into the skin, absorb the ultraviolet rays, and then release heat while they are protecting the skin. So they can be a little irritating to skins which are sensitive. So sensitive skinned people should not use chemical filters because they can be irritating, and should rather go for the physical filters. Chemical filters are aesthetically more appealing, and you have different filters for UVA blockage and the UVB blockage. Now coming to the UVB filters, now these are things you should look for in your sunscreen labels. So the most common ones are Padimate O or PABA. It's a PABA derivative. But PABA is considered to be carcinogenic and can cause a lot of allergic contact dermatitis, and so steer away from this ingredient in your sunscreen. Look for sunscreens that are PABA free. Okay, so Padimate O is a UVB filter. It is very effective but has certain side effects, so stay away from this filter. The other UVB filters are salicylates, you have oxynoxate, you have cinnamates. All of these are UVB filters. The UVA filters are avobenzone. Avobenzone is a very, very powerful UVA filter, but the problem with avobenzone is that it gets degraded very fast when it comes in contact with sunlight. So, and it also reacts a lot with other UVB filters, especially oxynoxate. So both these filters can negate the effect of each other when used together. But so because avobenzone is so unstable, you have to add a lot of other filters with it to give your sunscreen that substantivity and the usefulness that it is going to give you. The other UVA filters are benzophenone. Now, benzophenone is again something that many of us are worried about because there have been rumors and a lot of myths surrounding benzophenone. It is said to cause reproductive toxicity or allergic contact dermatitis, and it is even said to be environmentally hazardous because it was said to bleach the coral reefs. But the Australian scientists found that it's not actually benzophenone in sunscreens that bleaches the corals, but it was actually the change in the environmental temperature of the reefs that was causing this problem actually. We have other broad spectrum filters now like bimotrizinol and bicostriazole, which are tinosorb S and M respectively, which are being used a lot now in the sunscreens as broad spectrum filters. Now, chemical sunscreens, I told you, are aesthetically more appealing because they get absorbed on the skin, they don't sit on the skin, and they can be used under makeup. They do not leave a white cast, unlike the physical sunscreens. Now, coming to the physical sunscreens, they actually sit on the skin and scatter the UV rays instead of absorbing them. So because they are not absorbed and there's no chemical reaction that occurs in the form of release of heat or any exothermic reaction, they are very good for sensitive skins. And as I told you, these physical sunscreens are good for certain populations because they are devoid of any chemical filters. So what are the filters in physical sunscreens? Well, we've got 3: zinc oxide, titanium dioxide, and iron oxides. Now, these mineral sunscreens give the sunscreen a tinted look and a base-like effect or a foundation-like effect when applied. So if the color actually matches your skin, it can even work as your makeup. But the physical sunscreens are not aesthetically appealing because they leave that little white cast and they've got larger particles. So if you leave the physical sunscreen on for long, those particles can theoretically clog your pores, and acne and rosacea can get aggravated. But to make these sunscreens more aesthetically appealing or cosmetically elegant, silicone or dimethicone is added to them to give that lovely velvety texture to the sunscreen, which all of us love. But there's a flip side to this, because silicone itself can clog pores and in some people cause more breakouts. Now we're going to come to our next category or next type of sunscreens, which are the natural sunscreens. Now, even your chemical sunscreens can be fortified with these natural filters or natural ingredients like polyphenols or curcumin, or tannins, example green tea, or aloe, or certain volatile oils. All these are natural sunscreens, natural filters which block ultraviolet rays. And you can have these incorporated in your chemical sunscreens to give an added advantage. So for example, you can have tannins in your sunscreen, which is going to give that anti-carcinogenic effect of the green tea. Or you can have polyphenols like curcumin added to the sunscreen, which acts as anti-inflammatory. Aloe can be added to the sunscreen, which gives a moisturizing effect, and so on. Another type are the systemic sunscreens. You must have heard that when you're going out for a beach holiday, or your dermatologist also gives you a sunscreen to eat, an oral sunscreen. So what are the types of systemic or oral sunscreens? The most important are beta carotenoids or flavonoids. They act as very potent UV blockers. You have vitamin A, C, and E. All of these 3 vitamins are, when consumed orally, can act as oral sunscreens. Aspirin, indomethacin, and corticosteroids are also systemic sunscreens, but you shouldn't be using them. And of course, the age-old anti-malarials, chloroquine, hydroxychloroquine, are protective against the ultraviolet rays, and dermatologists prescribe these even for certain skin conditions that get aggravated by ultraviolet rays. So now I'm going to talk about 2 more situations, that's makeup and sunscreens, and insect repellents and sunscreens. So coming to makeup and sunscreens, you must have all walked into Sephora or your favorite cosmetic store and seen a lot of your makeup has SPF. Is it enough to actually, play the role of a sunscreen? Well, not really. Because most of the makeup, even if it has a high amount of SPF, can usually have a higher value of only 15 to 25%. And many brands have just about 4 SPF. Like calamine lotion only has an SPF of 2. So I don't think it is a good idea to swap your makeup thinking it's got SPF for a sunscreen. So you must layer your makeup and sunscreen, apply your sunscreen underneath your makeup, and step out. Now what when you have to reapply your sunscreen after 2 hours? That becomes a problem if you've got makeup on, because you can't keep reapplying it over your makeup. If you keep doing that, you're going to clog your pores. So what do? Well, there are sticks now that are available which offer sunscreens or SPF that you can use to touch up, or you can touch up your SPF makeup, or even use certain tinted powders on top which give that added protection. If you do have the facility, do splash water, reapply your sunscreen and makeup during your lunch hour at work, or find a way out to work around it. Insect repellents and sunscreens. You must have seen a lot of sunscreens with DEET incorporated in it. Now, DEET is an insect repellent, but it's not a very good idea to incorporate it in an SPF. A better idea would be to apply the sunscreen, let it dry, and then apply the insect repellent. So layering is always better, because when you incorporate or combine two things, actives together, it tends to reduce the activeness of the particular ingredient in it. Similarly, moisturizers with SPF. Well, moisturizers which are used in the daytime can have an SPF incorporated in it, but there have been a lot of studies that have said that the SPF in the moisturizer tends to degrade the activity of the moisturizer. And if you're using the same one at night, it may not be such a good idea, because the skin repairs itself at night, and you need that moisture to seep in to give back all the nourishment and the moisture to the skin. So don't use a moisturizer with an SPF incorporated in it. Again, layer the two. So when you're layering products, remember, you have to use the thinnest product first, and the sunscreen has to be the outermost layer. Unless you're wearing a makeup, in that case, wear your makeup after the sunscreen. Now, how do you apply your sunscreen? Make sure you're covering the entire exposed area of your face and neck. Do not forget a bald scalp if you have one, and the ears, and of course the hands and feet. So take special care of your temples, the tip of the nose, underneath your lower lip, the upper lip, the ears, and the neck. Now, before I conclude, what would an ideal sunscreen be? An ideal sunscreen should be broad spectrum. It should have both chemical and inorganic filters. It should be economical. It should be aesthetically appealing. It should be non-comedogenic. It should be non-irritant and hypoallergic. And dear friends, before I wind up, I don't think I need to reiterate how important it is to wear a sunscreen every 2 hours each and every day, because we are really concerned with the harmful effects of the ultraviolet, the visible and the infrared rays. Now, just applying an SPF probably would not be enough at times, and one should refrain from going out at the peak times when the ultraviolet rays hit the Earth's surface, that is between 10 a.m. and 4 p.m. So if you need to step out at this time, make sure you have additional coverage, like carrying an umbrella, or wearing a broad-brimmed hat, or wearing clothing that is protective. So be careful and stay safe from the sun. So dear friends, don't forget to subscribe to my channel, Dr. Gulhima Arora, and you can follow me at Mehekta Gulderma Clinic on Instagram too. I'll be putting up more videos on my channel on skin, skincare and hair care. So until then, stay safe.